Hello, welcome to RFA Tutor MRCP Group 1. My name is Dr. Abdul Khalik and I'm your mentor. Today we are going to discuss cardiac catheterization with congenital heart disease, in which we will learn that how we can understand the oxygen saturation in different congenital heart diseases. To understand that, first of all, we need to know that how much normal oxygen saturation is in the right-sided heart chamber, which gets deoxygenated blood from the peripheries, and what is the normal oxygen saturation in left-sided heart chamber, where we get oxygenated blood from the lungs. So if we talk about the atrial septal defect, where there is a mixing of oxygenated blood from left atrium to the right atrium, so you can see the saturation is improved in pulmonary artery, right ventricle and right atrium, which is 85%, but saturation in the left sided of the chamber, it remains same, which is 100%. If we talk about the ventricular septal defect, where there is a mixing of oxygenated blood from the left ventricle to the right ventricle, so you can see the oxygen saturation in pulmonary artery and right ventricle has improved to 85%, but saturation of oxygen in right atrium, it remains 70%. And if we talk about the patent ductus arteriosus, where there is mixing of the blood from the high pressure aorta to the pulmonary artery, so you can see here the saturation of oxygen in pulmonary artery has improved to 85%. And if you go down, so you can see with the reversal of left to right shunt to the right to left shunt, when due to the pulmonary hypertension the pressure in the right sided chamber has been increased, so you can see in all these conditions the saturation of the oxygen in the right sided chamber, like right atrium, right ventricle and pulmonary artery, it is 70%. But now in these conditions, as we are having mixing of deoxygenated blood from the right sided chamber to the left sided chamber, so in VSD you can see the saturation in left ventricle and aorta is 85%, which was normal 100%. And if you see PDA, which now with right to left shunt, saturation of oxygen in aorta is 85%, which was in case of patent ductus arteriosus with left to right shunt, the saturation of oxygen was higher in pulmonary artery because of more pressure in the left side of the heart. And if we talk about the ASD with Eisenmenger, you can see the saturation of oxygen has dropped in left atrium, left ventricle and aorta, which is 85%, and in right sided chamber is 70% in right atrium, right ventricle and pulmonary artery.